Hey, this is Sandy,
And Randy.
and we're here on AT Corner.
Being an athlete trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For our first education episode of National Athletic Training Month, we are going to bring back the position statement series, and we're going to be talking about the position statement on preventing ACL injuries.
How many people actually knew we had a position statement on prevention of ACL injuries?
We do. It is one of the newer ones, by the way.
So I actually, when you were talking about this, it made me just realize, in one of my classes that I'm taking in our Doctorate of Athletic Training program, we just talked about the difference between prevention of injuries and risk reduction of injuries. And so I think it's a really interesting topic because technically we can't prevent an ACL injury, but we can reduce the risk of one happening.
Yes, that's true.
And I think that's what they're trying to go for in this.
Yes, yeah. Yeah, and basically, how the position statement was laid out, it is introducing programming to help reduce the risk of ACL injury.
Exactly.
Right, and it was specified more towards the non-contact mechanisms. Obviously, you can't, no matter how much strengthening you do, you can't really control a 300-pound lineman just rolling into your knee.
Yes, you can. Steal ACLs.
You know what? That might be an idea right there.
Just do surgery on everyone.
Everybody.
Yeah.
Do it on everybody.
So what are our objectives for this episode?
So we're going to discuss the NATA position statement on the prevention of ACL injuries. We're going to discuss the components of an injury prevention program, specified, kind of laid out by the position statement, and then discuss the implementation strategies that we kind of talked about in the position statement.
And then this is a CU episode, so if you're listening to this as it comes out, or I guess anytime, make sure you check the show notes below to figure out how to get those CUs.
Yes.
All right. Are we starting with anatomy?
It's, in a way, not necessarily true anatomy, but we're going to talk about the value of ACL injury prevention programming. So it's like the anatomy of programming. You got to start at the foundations, why it's important.
Okay.
See? Foundations. Anatomy. So back to ACLs. The position statement actually did a really cool job at the beginning, like the opening kind of paragraphs, and talking about the true impact of an ACL injury. Obviously the cost to quality of life is obviously a big deal. It's kind of interesting to actually see the numbers, to really get an impact, like to really understand the impact of an ACL injury. I mean, obviously we understand like lost season,
right.
Rehab is a bear to do. It's a long road for our patients. But 63% was reported to return to their pre-injury level of sports participation. That's crazy.
I feel like you should never tell an athlete that.
Yeah. But isn't that crazy to think about?
What was the population of that?
Well, it's the position statement, so it's going off of like reviews and stuff. So it's just whatever the pre-level of sports participation. So if you were a high school athlete, you tore your ACL, you returned to high school athletics. If you were a rec athlete, you still return to your rec level. But to get more of a specific out of those for competitive sport, so maybe at a higher level, 44% felt that they were able to return to that competitive level of sport.
Wow.
And then here's the one that really gets kind of talked about when we start talking about ACLs, is that 4 times likely to develop knee OA, which is osteoarthritis. And the range that they gave was really interesting that's been reported is it's between 10 to 90%.
Oh.
It's a big range. Will actually develop knee OA within 10 to 20 years, which is crazy to think when you think of like, especially like in our setting where we're working with predominantly 18, 19, 20, 21, 22 years old, that they could have arthritis in their knees by the age of 30.
Yeah.
That's pretty wild to think how now they have another 30 years, 40 years, 50 years of progressive damage to the cartilage of their knee. That's pretty crazy.
Right. And not just cartilage, but beyond.
Yeah, but beyond, for sure. And the interesting thing to look at that they presented in the position statement was those rates were pretty similar whether you had surgery or not.
Of osteoarthritis?
Mm-hmm.
Huh.
I know, isn't that crazy?
That is actually a really good point to be made for, obviously, in the traditional setting, we're not really working as much with these, but for people who are not as active and maybe don't want to get it, go through the surgery and go through all the rehab and everything, I wonder, that's actually a really good tidbit to know.
Yeah. I mean, surgery alone is already pretty traumatic for the knee joint and just for your body in general. And, but also, even if there's a new graft in there, right, the mechanics of the knee have changed.
Mm-hmm.
You know, so it was kind of interesting to kind of see, because you do hear that, like, oh, well, if you don't get the reconstruction, well, you may have a high risk of arthritis. And then you also hear that on the other side, well, just because you had the surgery, you're already at a higher risk. So it's like, you know,
damned if you do, damned if you don't.
Yeah, seriously. Right. It just brings it up that really the rates are pretty similar.
Mm-hmm.
So now for more of a, like, okay, the actual economics, which is kind of interesting to kind of look at, is it was broken down for the surgical intervention per patient is up to $17,000. And it could actually have a societal cost over the lifetime of a patient of $38,000.
Is that including like all the physical therapy
and the complications that may come up after?
Oh.
So when you think of that, there's an estimated 200,000 ACL injuries in just the U.S. alone. Those numbers really add up.
It's a lot of zeros.
I think it was like the cost was like $3 billion or something like that. Or
ACL is $1 billion company.
Why does this feel like a big pharma commercial now?
Okay, so we kind of started.
You know what? ACL injuries are a conspiracy.
ACLs don't exist. They're not real.
We definitely cannot put that out there. It's right up there with the birds.
Yeah.
Birds aren't real. I mean, have you seen a baby pigeon? Exactly. Just saying.
Have you seen an ACL prevention program?
You know what? I have. That is so we do have them on that one. So speaking of seeing a prevention program, there are definitely some benefits that we could be getting from an ACL program. Obviously, the main benefit that we're going to look at, right, is does it actually help reduce that risk of ACL injuries? Mm-hmm. And they actually do a pretty good job of that. For a prevention program, an ACL-specific prevention program, there's around 50 to 60% reduction in the injury rates of ACLs. Mm-hmm. Now, how it was presented in the position statement was this was just any program. It didn't have any specifics. It was an ACL program.
Wow.
Yeah. So it didn't really describe the components of like, well, how many exercises, what were the exercises, right? They just specified here was the rate. Mm-hmm. If you use a multi-component program, which is breaking down into the different types of exercise, so like a strength, a balance, an agility, flexibility, like stuff like that, the rates were even a little bit higher on reduction. Mm-hmm. So that was between 60 to 70%. So you can kind of see a multi-component is a little bit better than just maybe a single or just a whatever is out there kind of thing.
These are better numbers than the amount of people who actually go back to competitive sport.
Know. So it just shows, hey, the prevention part might be a lot, like a nice little, might be a little more important than necessarily. I mean, obviously the rehab's important, but like, hey, we want to try and prevent these problems as best we can. Mm-hmm. The added bonus of doing these programs, I mean, do we really need an added bonus after the ACL part? I mean, ACLs are already costly, so that's already good enough, right?
Right.
But the added bonus is it actually does help prevent other lower extremity injuries. So these multi-component programs reduced injury risk by 39% for just lower limb.
Oh, good.
Mm-hmm. and then 54% reduced risk in just acute knee injuries in general. I mean, it kind of makes sense when you think about it, like the components of like what ACL protection would be. It's those mechanics of ACL tear are pretty similar to most other lower limb.
Right. But I feel like
causes.
it's also learning where your body is in space as far as a non-contact as well.
For sure. And we will talk about that when we start talking about like the components of what it is, but it's true, right? It is talking about your body in space and like, again, right, a big portion of these programs probably have some glute stuff, which we know the glutes are everything.
Yeah.
That's
glutes
the answer.
And core. That's all you need.
Boom.
You know, you
Boom.
need to rehab a shoulder.
Glutes and core. Hey.
No, but
true.
for real.
You know what? My biomechanics professor in my undergrad, he basically said there's literature out there that says the glutes are a risk factor for injuries basically from the neck down. And he's like, don't worry, there'll probably be stuff on head too. So the glutes are very important. Now for the more performance side, right? Because like these prevention programs are great for the injury prevention, but like some people really like to like, well, I need performance. We're all about performance.
Right.
There actually may be some performance improvements as well, right? They may help depending on how the prevention program is structured. You could see some improvements in vertical jump, maybe some hop speed. I think there was some components of maybe VO2 max getting some benefit.
I could see that.
Yeah. But a lot of this, and we'll talk more about the duration, is it's mostly seen in longer duration programs. So like it has to be like you have to do a workout, right? We're not just doing like do a couple exercises.
Right.
So those are all definitely things that, like, yes, the ACL component's great, but here are some other things that could be beneficial to implement in a program like this.
So what are some of the biggest focuses on the injury prevention programs that actually make them work?
Yes. So that is going to be the $1 million question. And we've kind of talked about this with like our past like pathology episodes of like, okay, well, what is our like exercises really doing? And like, what are we trying to do? What is actually happening? And essentially when we're doing these prevention programs, we're trying to change biomechanics, right? Because that's the whole point of the non-contact element, right? Faulty mechanics can lead to injury, right? So we're trying to change that. And the literature has supported the decrease in ground reaction forces, right? So from landing from a jump, running, stuff like that, right? And the improvements are basically coming from the hip and knee are increasing their motion, right? So those joints are able to absorb force better than just, as opposed to not as much motion, and now soft tissue is actually absorbing the force.
That makes sense.
Yes. Now, for the other biomechanical variables, the literature is a little bit murky. It's not as consistent with like the ground reaction force literature. So like modifying hip and knee motions in the transverse and frontal plane, maybe not. So this is like your knee valgus, your all the fancy like, knee adduction and like all that fun stuff that you only need like super expensive equipment to detect, is a little bit iffy. And you know what? I mean, we've talked about it before with like other episodes in rehab, is like, it's really going to depend on how you program that prevention program or that rehab program, right? If you're focusing on correcting motor control, then yes, you might see a change in those mechanics. But if you're just giving strength, like quote unquote strength exercises, hey, here, you're going to do some clamshells, how much is that going to translate for sure into I'm changing my mechanics? Right? Yes, it's important for a strength aspect. You know, maybe someone doesn't have enough strength to even start motor control stuff, right? But it does, if you're trying to change the actual mechanics of something, you might need to spend a little more time with, okay, hey, let's focus on how we move and train that and teach you how to move.
Right. I mean, it's the same thing we talked about a couple episodes prior was like fall training.
Yes, yeah. Yeah, for sure, right? Like being able to actually have the mechanics to know where you are in space. It's not just strength thing, right? You have to kind of know how your body moves and be able to understand those mechanics in order to do it.
But also reacting.
And reacting, absolutely.
Because if even if something unexpected happens, if your body is able to have a movement pattern that is safe for it, that is how your body will default.
So sports aren't 100% planned? Not every movement's super planned out?
You know what? I thought they were.
But no, yeah, that's definitely true for sure. Like making sure that you do have a plan. So now that was the anatomy of the prevention program. So now we can actually talk about the components. And this is where like the meat, the body of the position statement really kind of talked into is, okay, here's why the prevention program is important. Now let's talk about, okay, what does it look like? Here's how you can actually start designing one.
Right.
So the first thing that they broke it down into was, okay, it should be multi-component, right? And how they presented the literature is a multi-component program is superior to a single component. So a multi-component, right? So you're doing we'll do a strength exercise, a flexibility, and then we'll do like plyos, right? As opposed to a prevention program that just said, oh, well, we're just going to do strength.
Or just the people who just do plyos, right?
Or
right.
just doing plyos, right? It has to be like multifaceted. That's a nice buzzword.
There you go. It's just like concussions. I mean, when
Yes.
you are trying to evaluate them, you're not like you're just going to use the SCAT or you're just going to use grade symptom checklist or something like that.
Yeah. I love looking at it that way. And even the care of a concussion, it's
Right.
multifaceted. It's not just,
Because some people won't have positive VOMs
Yes.
or like changes in VOMs, but some people will. So it just,
for sure.
you have to work on everything.
So the position statement recommended that at least have one exercise from at least 3 categories.
Okay.
Right? So maybe pick an exercise from strength, pick an exercise from plyos, balance, whatever, right? They just want to make sure that, hey, at least you're getting one from some of them.
Did they write what categories?
It just was just any one of, like, you just need at least 3 categories. So whether strength, plyo, balance, agility, or flexibility.
Those are the 5 that they...
Yes, that was presented.
Okay.
So the caveat that I'd put to this would be, the position statement also did say it was there should be an emphasis on movement technique and quality, right? It's not just, of course, we're never going to just like give someone a band like, hey, go get them, right? But like it should be like, hey, if they're doing the exercise, let's make sure that that either us or whoever's overseeing the program is there to assess the movement quality and make sure that they are performing the exercise correctly, right? Because a lot of times, it's not the AT that's necessarily running the prevention program. Sometimes it's the coach. Sometimes if you're in a place that's lucky enough to have a strength coach, a lot of times it's the strength coach, which that is really awesome when that happens.
Right.
So essentially whoever is overseeing that program should at least have some training and be able to understand movement and be able to correct it or observe technique. Right. So that was the one caveat. So it does still kind of lend support that you can't just necessarily give a strength program and just be like, okay, go get them. Right. There still has to be some cueing there. Make sure that the movement is correct. So the next kind of consideration to a prevention program is, how long am I spending on this thing?
That is the biggest thing when you're trying to implement what coaches are going to ask. Because they're like, how much of my practice or like how much time do we have to devote to this? Do I have to get the captains to do this before practice, to call them before? Or like, is it going to cut into my time?
100%. All right. So it was kind of nice to see that there is literature on this that actually looks at like how long a session is and that, like, does that do anything?
Well, we don't do 3 sets of 10?
You know what? It didn't really break it down in sets and I was really bummed out about that. Because I'm sure everyone does 3 sets of 10, so it'd be interesting to see what the literature would say. That's so funny that we all know that. You know what I mean? It's like it's almost like that's all that's taught. It's like, nope, 3 sets of 10, that's it.
Well, it's because it's between 8 and 12.
It is, yeah. It's
according
a good
to
number.
NASM.
Yeah, it's a good number.
So right smack in the middle, like if that's your strength goal, then do 10.
Yeah, that is a great number. So what the position statement was basically saying is sessions should be at least 15 minutes long. That was right around that spot. That was kind of the lower time to actually start to see reductions in ACL risk. Longer sessions, so this is kind of going over 20 minutes, have been shown to be superior, right? So obviously there's a lot more of a stimulus, especially like a strength stimulus or a motor control stimulus, right? And it's actually about 26% lower of a risk compared to those short sessions of around 15 minutes. All right. So yes, short can work, right? But if you're going longer is also a little bit more beneficial. So if you can, and it's only really adding just a few more minutes, so that might be feasible, not all the time, but maybe. Also, those longer sessions have been shown to maybe promote more of the athletic performance aspect, and it makes sense. Again, bigger stimulus, you can actually now start seeing those athletic components being improved. But there is a drawback to longer sessions. And one thing that they were accounting for is compliance could become an issue, right? Like you said, coaches, right? Well, if we're doing like a 30-minute session, okay, well, now how much time is being taken out of practice, and like how willing is the coach to be working with that? Same thing for the athlete. How many times has an athlete come into the clinic with only 15 minutes to spare?
Right.
It happens all the time. So sometimes that could play a role. Also too, like, I mean, if it's really long, like, sometimes it gets boring. If something's really long, you'll just be like, oh,
right.
Gotta do this again.
We just have to get through it, and then our movement quality sucks, and then the whole point of the program goes out the window.
Yes. Yeah. Right. We want to do things with purpose.
Right.
So those are all kind of things like, hey, keep in mind with your longer sessions, right? There's a lot more that goes into it than just necessarily like, oh, well, longer's better. Let's do that. So now that we have the timing down, right? So we talked about single session, how long are we doing it? Okay. How many times a week are we actually going to do this?
And I think that's where the cutting into practice time kind of comes in.
True. And I think that the athlete side of things, right? Now, if I'm doing something for like 30 minutes every day, I mean, how often are you going to really want to do that anymore?
Right.
So I think that does play a role. And how the position statement kind of had it was looking at about 2 to 3 times per week was that kind of nice number to at least do that. It's a little bit better than just a single session, and it was actually about 27% of a greater decrease in risk compared to just like, hey, just doing it once a week. So, of course, anything is better than nothing. So if a single session is all that can happen, like, hey, I wouldn't be like, oh man, we shouldn't do this at all. All right, but just know, hey, 2 to 3 times per week, a little bit more beneficial. So if you have someone who's like kind of struggling with that just once a week, just be, hey, dude, let's just get one more.
Right.
Just do twice.
Right.
And that it actually shows like that could be actually a lot more helpful than just that once a week.
I wonder too, though, you'd have to work with your coach, and depending on what sport, and depending on what your program looks like, but the soreness and how to play around with game schedule. Yeah.
That's all a big component of it, and that'll kind of go into some of the implementation stuff as well. But yeah, that's true. Definitely talking about kind of like, okay, now you have to manage an athletic schedule. Like on paper, it sounds great. Oh yeah, we'll do this like this time each week, and like, but once we start getting into games and harder training, like, okay, now we got to kind of adjust, because at that point, if we're in like really sore, like really fatigued, like now the movement quality is going to go again, like you said, out the door. So now could our prevention program actually be creating problems?
Right.
We want to balance that.
Right.
So that actually ties into that implementation plan. Like we said with like the compliance stuff and the timing stuff, right? A big component's going to be actually talking to everyone who's going to be involved and all the stakeholders. Right, making sure everyone understands and is on board with the benefits that this program can provide. Right, we want to try and keep our athletes healthy. Right, keep them on the playing field, the court, the pool, the water. Keep them in the water.
That's a good one. We don't usually talk about that.
I know. I just we always say field, court. I just want to add in water. All right, so that's a big component of this. Decreasing costs. So obviously we talked about all that monetary value to these kind of injuries, and a lot of people don't necessarily think about it, but like, oh yeah, well, the school will pay for it, right? Well, we have the school's insurance. Well, once they start getting billed with higher costs on that insurance, their premiums start going up. Then the schools,
Right.
depending on the school, right, they might be like, well, this is getting expensive.
Mm-hmm.
And then obviously there's the component of improving performance as well. Which you could look at, maybe the prevention program does, but also, if they stay in training, if they're healthy and stay in training, theoretically they should be getting better too. More opportunity to get better.
Right. It's almost like when you talk about the really big topic right now about multi-sport athletes.
Yes.
Because movement quality is a really big one too.
Yeah, 100%. I
feel like people sleep on that.
Yes, for sure. Even from a rehab perspective, I think sometimes the focus on teaching movement quality, because it does take time, sometimes does get slept on.
That's actually something that, like, growing up in performing arts and gymnastics and dance and things that really had a lot of body control, it really, really opened my eyes when I started working with athletes who did not have coordination.
That's true.
And I was like, how are you an athlete who moves like this?
Yeah. Yeah, that's true.
It just does not make any sense to me. And actually, there's a lot of research upon dance and the really low ACL risk that they run.
You know what? I was just about to bring that up.
Especially in ballet, because you think about moving in an externally rotated position, like hips are externally rotated maximally as much as possible, pretty much the entire time that you're performing. And if you are like the amount of jumps that you do in the landing, some of the jumps especially, you'd think that they would land in a valgus position or hyperextension or any of those like quick rotation of femur on tibia, but the glute hamstring ratio and movement is just, the risk is really low there.
Yeah. And I was going to say, you kind of have some experience of seeing like a program like that.
So that's actually a project that I did for my undergrad capstone. I took football players and I put them through a ballet program for 10 weeks. And we looked at jump and landing techniques, which their landing looked so much better after the 10 weeks. And none of them suffered an ACL injury, but they were also, I think it was like 10 guys. So,
Still,
it was a case study. But yeah, I have a video on it if anyone wants to.
Yeah, that's true.
Yeah.
Yeah, and plus, when you think about, that kind of style of dance and like ballet, do you think you can pull out 3 components from that kind of exercise that actually match
balance, plyos, strength, agility, flexibility? Yeah, definitely.
Yeah, see? So it matches what the position statement's saying.
Exactly.
Look at that.
That is one thing that I've noticed, that when people are trying to put together ACL prevention programs, I feel like a lot of people are like, oh, let's just work on landing techniques, or let's just work on just agility or something like that. And honestly, I think that it's also daunting for people who haven't put together an ACL prevention program to want to, but there's so many already out there that I feel like have the research behind them or even have people who've implemented them on their campus, that you can even start with those and then kind of change up what you like and don't like the FIFA, what is it, FIFA 11?
Yeah, FIFA 11. FIFA 11 Plus now, I think.
I haven't used that one.
They've added a plus.
But there's like so many, like even if you just look up ACL prevention program, as long as they have multiple parts of categories, I mean, you're looking pretty good. And actually, one that's not mentioned here is like change of direction. Yeah,
for sure. Some of it, change of direction is not necessarily in there, right? So, speaking of the FIFA 11, it's fun that you brought that up. It's like, I've had a team utilize it in the past, and like we still had like injuries and stuff. Now, granted, some of that was, hey, we're coming off of COVID, but it's like they were perplexed, like, well, we're doing this program, like, Yeah, but like one, it's not like just because you do it doesn't mean it's like guaranteed. Like no one's ever getting hurt.
Remember, we talk about prevention
Yeah.
versus risk reduction.
Yeah, and then also too, it's like, well, let's get feedback from the people who are doing it. Right, the FIFA 11 is great, right?
Mhm.
But like how the coaching staff was implementing it was like a lot of the athletes were like, well, I don't feel like I'm getting a warm up. Like I don't know, like I don't feel like we're
Oh,
getting anything out of this. So it's like, okay, well, hey, that's awesome that like the coaches tried it, right? That's great. That's all we can do.
Mm-hmm.
Obviously, the athletes didn't like it.
Right.
Okay, let's change it up. Let's see
Mhm.
what else we can do. So yeah, just because like, hey, you grab this program, right? It still needs to be tinkered, and it's not always 100%. You know,
Right.
it would be cool if it was 100%. If there was a program that could prevent all injuries, we'd probably be rich. A part of the like education part, again, like kind of like what we were just bringing up with like the coaches implementing things, is just making sure that everyone is like trained to be able to implement the program, right? Make sure we know what we're looking for, or like, hey, if you see this movement pattern, like, hey, here's what we need to do to kind of correct it, or like, here's how you would cue it and stuff like that. You know, just make sure it goes well. And again, sometimes this falls on the team captains,
Right.
who are also just athletes who may not necessarily have training in kind of these techniques, so make sure that they know how to.
I mean, have you ever gone out and watched the dynamic warm-ups that teams do? Like, how many of them are doing the Frankenstein kicks and like not even like they're just walking?
Oh yeah. My favorites are the like the single leg deadlift.
Mm-hmm.
And it's just like, ooh, no.
Yeah.
Now we're just bending over.
Yep.
It's just that I don't think that's achieving anything.
Nope.
Yeah, that's a good point. Yeah, there's definitely times that it's not so dynamic, or it's done wrong. Amic.
Right. Right.
I coined that
Honestly,
term right there.
there's some ACL prevention programs that include like partner work, and those ones like you just have to get buy-in. You know,
make it fun.
Because if you get buy-in, then you're gonna get better movement quality instead of
Yeah.
just like half-assing things, and then you get what you put into it.
Yeah, 100%. So now the next kind of consideration when you're talking about implementing, so everyone's educated, and now we're like, when do I do this? Right? And we actually kind of brought this up, and it's right. The position statement recommended that this should be done in the preseason and in season.
Mm-hmm.
Right? So right before their season starts, let's throw that in, and as we go through the season, let's make sure we're still doing it. All right? Doing both was found superior to then just implementing it in one or the other. So like, hey, we only did it in the preseason, or we only started doing it in season. All right? So being able to, hey, let's kind of work this through the entire time is a little bit better. Plus, being able to do both preseason and season, it kind of it gives you a longer duration of how long you're being exposed to a stimulus.
Mm-hmm.
So then you can probably start seeing a little bit more gains than just if it was a shorter time frame.
Actually, that's a really good point, because I feel like a lot of times coaches are like, oh yeah, I want to do this before the season, and then like, oh, we're not going to do it like in season.
Cool. But like we talked about not just a few minutes ago, was but in season you got to manage a little bit differently,
right?
Like you can't just throw out 1 rep maxes in like mid season. That probably ain't gonna go well.
They do.
Yeah, they do. Yes, they do. But yeah, right. It does bring up that, hey, we did in preseason, that was great, but then like you lose it in season, and then midway through the season, well, a maintenance program probably would have been nice to do, and just for sure.
So our football team this past year started doing with our strength coach, stretch and flex and next. I can't remember what it was called.
Every program needs to have a cool name, by the way.
I think it was flex and next, because they would do either
great.
stretching or they would do neck strengthening, and our strength coach did such an amazing job, and just from the conditioning, the and the addition of, and it was twice
Yeah.
a week, so it was Tuesday and Thursday, and I want to say it was like 15, 20 minutes.
Yeah.
That they would either work on mobility or they would work on some extra strengthening stuff, but we really saw a reduction. Honestly, I didn't really have to deal with that many soft tissue injuries this year.
That's awesome. That is awesome. That was one thing. So that same team that I worked with, the next season, they changed their like warm up routines and like how they started practice, and they did start focusing on more movement quality stuff. And that I would say we definitely didn't have an ACL tear that year.
Nice.
I'm trying to think. Yeah, didn't have an ACL tear that year after like basically 4 the year before.
Oh my gosh.
And then very minimal soft tissue, like non-contact soft tissue. Right. Obviously, ladies, stepping on someone else or someone going in with a hard challenge, right? That happened, but
right.
No non-contact stuff. So yeah, it does make a difference. And I'm glad you brought up the strength coach aspect, because I feel like they're in such a perfect position for programs like this, right? It's perfect to implement into their warm-up, into their lifts,
right? How
they program the lifting sessions, or each phase. So like strength coaches for sure. Like if you're lucky enough to have one on campus or working with your population, oh my gosh, it saves you a big headache.
Yeah, our strength coach was super excited to work and collaborate with us on some of the stretch and flex, or the next and whatever it's called, flex and next.
I like it. Either way, I think it sounds great.
So I mean, it's definitely something that you can ask to collaborate on, or see what they're doing presently, or see if that's a thing that you can
100%
work together on.
And you know what? It's mutually beneficial. Like,
exactly.
It takes a lot off of our plate that they're doing that, and then they are very grateful that I've seen in the past that when someone's hurt, they're like, here you go, take them.
Yeah.
I'm like, I can do that. I got that one for you.
I feel like the experiences that I've had with strength coaches have really been injury prevention focused anyway.
Yeah.
And especially that I've worked with some great strength coaches, and I feel like they are they really take it to heart if someone does get injured. They just like really like go over, okay, well, what were the things that we were doing that could we have overloaded this, or like what they really like take it to heart.
They really do. You're right. I have had that before where I've had strength coaches kind of come up like, hey, like someone got hurt, or like mostly it's like in a one situation, hey, someone got hurt, and they come in and like, oh my gosh, like what? It's like sometimes it just happens.
Right.
Sometimes it's athletics, just people get hurt. I still stand by my statement, and I always will. I think strength coaches are some of the just most brilliant people because they have just all the smarts, all the like the technical knowledge, and they do it in the most practical way. Some of the most smartest people out there. Man, I hope the strength coaches pick this up, man. We're really hyping them up. This could be a good start to their morning.
Yeah.
Okay, so we have we're training people, stakeholders know what's going on. We know when we're doing it, but who exactly should we target? And to be honest, right, everyone could benefit from an injury prevention program, but sometimes that's not feasible. So there are some groups that, hey, we can focus on. Part of it is the youth, and I think this is actually, especially ACL stuff, and I think probably other soft tissue injuries, this is where a big difference can definitely be made. And that's why, like, again, with all the respect that we already have for those high school ATs and those ATs that work with more, younger populations, right? They're in such a position to create a big effect for just their lifelong physical activity. So, some of these prevention programs, they've seen that mid-teens had a greater response to the prevention program compared to those older ages. Right. So, their bodies are obviously changing, right? And we're not trying to go down the puberty talk here, but like, obviously, right, their body is going through an adaptation, right? They're in a major time of development
Mm-hmm.
that like being able to influence their mechanics is they're just so much more sensitive to that change, and hopefully it stays a little bit longer.
Well, I was just about to say, if you start it early, then hopefully that's gonna stick.
Actually, too, I'm glad you brought that up because, again, in the position statement, they did talk about, like, if you start when they're younger, it just becomes a part of their athletic routine.
Right.
And it's not foreign to them when they're older and all of a sudden a program's being implemented, and they're like, whoa, what is this?
Well, even like I had a basketball player who was easily the best on our team. He's a great shooter.
Uh-huh.
He was definitely going places, but he wasn't being looked at by D1s, and the reason why was because of some weird way that even though he was making the baskets, it was the way that he was shooting the baskets that just the technique wasn't going to be something that he could be successful on in the future. And so it's like, man, if he would have he found what works for him.
Of course.
But even just like growing up with that, it's going to be so hard to change that at that level. Whereas like, this kind of reminds me of like all this movement quality, ACL prevention. Yeah. If you are able to get that coordination early, how that sticks with you.
Yeah, for sure.
And how much easier it's going to be for you to work on these things rather than someone who just really doesn't have that motor control.
Definitely. For sure. The next group to focus on are those with a previous ACL injury, as we've talked about with other pathologies, right? Previous history of injury is the highest risk factor, right? So, and this is one area that I really focus a lot of my like quote unquote prevention stuff on, is those that have had previous injury risk, because I think it's more manageable to like, okay, this group we already know is at a higher risk. So you have a subset of athletes that, hey, I can target interventions at and have a big impact, as opposed to the daunting task of, I'm going to give everybody this prevention program. Like sometimes that can be pretty daunting. So I think this is one area it's a great place to start, and you could still see a big impact. And then, of course, athletes in high-risk sports like football, basketball, soccer, right? A lot of those sports that have a lot of jumping, cutting, right? Those are like high risk for, ACL injuries, right? Football and soccer compared to like golf, right? Like that's going to be a little bit different, right? So
did you see that softball player who just tore ACL while
I did
pitching?
I did. So those high risk groups could also be kind of the focus of your rehab program. So you don't have to necessarily think like, well, man, I got like 22 sports. Like, how am I going to implement this for everybody? Well, hey, maybe you can implement just on certain subsets, and that might be more feasible.
Right.
But
I think also looking at, to make it also less daunting, taking the rehab that you're doing for ACLs and realize that those high level exercises that they are doing to get back to sport are the same ones that are going to keep them in sport and prevent or reduce the risk of those.
Could
injuries.
You pull out 3 components from those?
Balance, agility.
But yeah, no, that's very true. So there you go. There's ACL prevention.
What is our action item?
Have 3 components.
Here, we'll go over them again.
Yeah.
Strength, balance, agility, flexibility, plyos.
And then
how could we forget plyos?
And then just make sure we're doing them 2 to 3 times a week, at least 15 minutes, which I really think that was really kind of cool to see the 15 minutes part, because like I feel like that is pretty feasible, even for the athlete that doesn't have a lot of time. Okay, cool. Hey, you're already on this kind of program. Let's do this. That's your prep for the day.
And honestly, you know what actually might be something that would get coaches' attention, and something that I don't think they've really talked about really before, at least in the research.
What?
Could you do these ACL prevention programs at the end of practice? Reason being, because a lot of ACL injuries especially non-contact and movement quality based ones, happen at fatigue. So if we're training at fatigue, am I onto something?
Hey, I'm gonna let you finish your thought. Go for it.
That's my thought.
Okay. So
And it doesn't take away from the beginning of practice.
boom. I'm gonna call your idea.
Okay. Patent pending.
And then I'm gonna raise you some support.
Okay.
So I'm not sure about specific like ACL.
Okay.
But they've looked at I think, and this is actually a good segue into our hamstring episode way back when.
Way back.
That was an oldie.
Mm-hmm.
Oldie but a goodie.
Mm-hmm.
In like hamstring programs, that there's a strength endurance component.
Mm-hmm.
And if you want to train that kind of like that endurance, that strength endurance component,
Mm-hmm.
you would do your intervention program after their training.
Right.
So yes, there is support that does help with that endurance aspect of strength.
Mm-hmm.
The only caveat though is it doesn't do a lot to increase the strength. So it kind of depends on your goal. So yes, that is possible.
So strength before. Well, I mean, you would do that for rehab anyway.
Yes. Yeah.
Because
That's what
you don't want to start with your cardio and make them all tired and then not be able to do their strength exercises. But maybe at the beginning, like no one says that you have to do 15 minutes straight, right? So what if you do strength?
Point, actually.
What if you do like a couple strength exercises at the beginning, do like 5 minutes, and then at the end of practice, you do 10 minutes of agility, plyos, change of directions, stuff like that.
Holy smokes. That's that's a good point, actually. I wonder how much that would make a difference. That like it's not it's just the amount of time of 15 minutes as opposed to 15 minutes straight.
Right.
I kind of like that idea. Dude, I don't know if it's because it's late, but my mind's blown. That's a good point.
That's
a good point. Like if you're running short on time with somebody, right? They come in, only have 15 minutes.
Mm-hmm.
Right? That's my favorite one. Okay, well, let's do this real quick. Cool. Check that one. And then after practice, we do this part.
Right.
And this is our goal. Because I can also see it too from the standpoint, like we said, right? Like, okay, the prevention program, like you're going to tailor it based on what's going on. So, hey, maybe like this amount of weeks, it's before practice. And then this amount of weeks, we're doing it after because now our goal is to focus on the endurance part, not necessarily trying to increase our strength
right
or our power.
Mm-hmm.
We're trying to increase our endurance to maintain that strength.
Mm-hmm.
That's a good. I'm really intrigued about how that would work with the like splitting the time.
Mm-hmm.
Researchers,
let us know.
Yeah, please let us know. Someone let us know.
Or if someone has put this together. Yeah, totally.
Yeah, I like that. Ooh, that's the action item.
That's
right
the
there.
action
That's
item.
the action item.
Think out of the box. That's your action item.
Yes, it is.
So if you have put together an ACL prevention program or a risk reduction program, head over to our Facebook group. Tell us about it. We're going to put up a little comment box that you can share your ideas. Some other, share some programs that you've used or that you've created. We'll share some ideas of things that we've created. Just.
I'm sorry, I'm still thinking about that idea because you could do the flexibility component before practice,
right?
Get your mobility,
Mm-hmm.
and you can do the rest. So it's like a Rubik's cube, just so many options.
We're gonna be here all night.
We're gonna be here all. I don't think I'm gonna sleep tonight because my brain's not gonna turn off.
Good.
It's gonna be
good. That means this episode did what it needed to.
Yeah, that's right. If you haven't noticed by now, I'm pretty nerdy.
No, I haven't noticed. Okay, so if you guys are new, we do every other episode as education or stories. This one was an education episode. Again, make sure to check the show notes for your CEUs. If you're interested in other CEUs or a subscription to CEUs, we do have a MedBridge subscription that you can purchase with the code ATCorner to get $150 off. And then, anyway, back to every other episode we do as educational stories. We are doing next week, I believe, is odd mechanisms of injury.
That's fun.
Yes. A throwback. We really enjoyed that episode last time we did it. So we are going to get some new stories, throw them at you.
What's funny is I'm sure, from my experience of odd mechanisms, I feel like there's going to be a lot of track athletes.
Okay, I'm going to hold you to that.
Yeah, I'm just saying. In my experience, they're the ones who tend to get the, wait, what happened? What did you do?
So I'm going to save it for we don't have to share story time right now. But I do have to say, I did have an athlete come in today who hurt his thumb and would not tell me how he injured it.
And was it track?
No, it was football.
Okay. Well, maybe I'm not surprised. Okay.
It's like, I don't think I want to dig for this one. If you don't want to tell me, I don't know that I want to.
Yeah, I don't want to know anymore. When they start acting weird, it's okay, never mind. I don't want to know.
Right. Yeah, I think that's all my fine print.
Perfect. Thank you for helping us showcase athletic training behind the tape. Bye.